from Rwanda and other countries. We also have some representatives from Nile Gal Forum, right? Yeah, Nile Gal Forum, UNIPA. UNIPA, can you also wave? I know UNIPA has a big network in the room. National Youth Council, we have representation of the National Youth Council in the room. And many others, I cannot, mention everyone and finish. Lastly, before I go, Honorable Minister, I would like to recognize other partners with whom we have organized this event. And I would like to, right now, request every one of us to give a big round of applause to the National Population Council. Yes, with the support of Dr. Betty. Dr. Betty loves young people so much. She's always been there for us. All the time we reach out to her. Thank you. And also Dr. Jotham. Please send our regards to Dr. Jotham. We really wanted him to be here, but unfortunately he couldn't make it. But you're representing him, so it shouldn't be a problem. But we love Dr. Jotham so much because he thinks about young people. I know he's one person who always goes to the president and reminds the president that, look, Your Excellency, you talked about sexuality education. Look, Your Excellency, we need young people to be supported in different ways. And then also, I want to recognize UNFPA, the United Nations Population Fund. You can give them a big round of applause also for supporting us. And also, I want to recognize Planned Parenthood Global. You can give them a big round of applause because they've made this engagement happen. Now, without further ado, I'm going to request my boss. Some of you think that I don't have a boss, but actually I have a boss because she's always in the background. Honorable Esperance Abagoma, who is the Deputy Chair of the WAF Board of Directors. I'm going to invite her to come and give us some brief welcome remarks, and then after we shall proceed with our program. Thank you.
Thank you very much. Thank you very much. Are you getting me? Thank you very much, Patrick. Our dear guest of honor and my good friend, Honorable Anifa Bangirana Kawoya, Minister of State for Health General Duties, Dr. Dina Nachganda from National Population Council, our dear development partners present, without mentioning one by one, the young people, the reason why we've gathered here today. Ladies and gentlemen, good afternoon once again. Well, I had already made my remarks, but I'm glad to use this opportunity to welcome in a special way our chief guest, Honorable Anifa Kawoya. I want to use this very opportunity to congratulate you upon your elevation to the level of a minister, which was well deserving given the service you have rendered to this country. Briefly about Uganda Youth Adolescent Health Forum. This is a youth organization by the youth to advocate for youth health, reproductive health rights programs, and where an opportunity strikes to actually even implement them. And today, we are here to discuss the commitments which were made by a delegation that represented Uganda at the ICPD25 summit in Nairobi in 2019, and particularly to discuss the commitments in line with the youth sexual reproductive health and rights. We feel this is a very important meeting, Honorable Minister, because we have the very concerned citizens here, the youth whom we are talking about. And therefore, we are to review their commitments, see how far we have gone, see what gaps are there, and how quickly we can make sure that we achieve the commitments we committed the country, this country. In the wake of COVID-19, Honorable Minister, a lot more challenges have come up. There is teenage pregnancy and early marriages have gone higher. as a result of the schools not being operational. And we have had a lot of incest in these cases. There is a lot of gender-based violence, and therefore there are very many more challenges that have come up, and some traditional challenges that have been there have actually increased in number. So that makes it very important for us to meet today, and that's the reason why UAF, together with our other partners, decided to organize this meeting. We welcome you today, and we are very happy that you're part of this engagement, because we know, Senga, you're very good at advocacy. When you decide to advocate for something, then you have to achieve it. So we welcome you today. We request you to be part of our team as we engage with the youth, and to even further our advocacy to another level, to government level, to the cabinet level, so that we'll be able to achieve very fast what we are set to achieve. I don't want to say more than what I have already said. I welcome you so much, and wish you good stay here with us and good deliberations with the youth of Uganda.
Thank you very much, Honorable Esperanza. Now, I've been reminded, before we proceed with the official opening, there is a video that was compiled that expounds on the magnitude of sexual and reproductive health problem and teenage pregnancy problem that has been compiled, and we wanted to make sure that we premiere it right now before NPC and UNFP and the minister speak. So I'm going to request Honorable Minister and your team, if you don't mind, for you to be able to watch the video properly. You move and take the other seats such that you are able to watch that video, since we are going to be playing it from the side of the screen. I don't know if that's an inconvenience, but I apologize for the inconvenience, but I want to make sure that you are able to watch that video. Moshe, are we ready?
Teenage pregnancy is one of the most devastating reproductive health challenges and has consequences not only for the individual, but also for the newborn and children born. Teenage pregnancy is one of the most devastating reproductive health challenges and has consequences not only for the individual, but also for the newborn and children born by adolescents, the community, and the country as a whole. While still there is little intervention done towards its prevention, mostly due to cultural limitations like the assumption that if teenagers are given access to correct information and services, it will result in them indulging in early sexual debuts and getting pregnant. Other social cultural norms and harmful practices like sexual and gender-based violence and child marriages also expose young people to early and unintended pregnancies. Additionally, lack of access to quality and non-judgmental youth-friendly health services has also limited uptake of family planning services among many sexually active young people who do not want to get pregnant.
People are getting pregnant, like encouraged, led to, and they don't know that it is bad. They don't know where to report, they don't know how to report it, because you're looking at a case whereby you're being raped by your father's best friend. So you wonder, where should I report exactly, to my father or the police station?
Kupata mimba na wangali wadogo, kukosa information, wazazi wabaya, na ingine ukosefu wa vitu fulani like pads, na ingine pesa tu, anatafuta mwanamume, anampatia pesa kisha nyuma anampatia. Sama wanaume wanamdanganya, wanakuja kumpatia kavitu kadogo,
As a result of factors like the above factors, 1 in 4 girls in Uganda between 15 to 19 years are either pregnant or have engaged in childbirth, accounting for 25% of teenage pregnancy rates. The general sexual health indicators for young people in the country show negative trends, with rising early unintended pregnancies, unsafe abortions, increasing sexually transmitted infections, rising child abuse, including gender-based violence and sexual abuse. Quite often, many teenage mothers and pregnant teenagers are less likely to visit a health facility for antenatal care or postnatal care due to factors like fear of judgment and stigma from health workers, long distance and lack of money for transport, and limited knowledge on the availability of the services, among others. Tororo and Butaleja districts in eastern Uganda are among the most affected, with high rates of teenage pregnancies and child marriages. According to local media reports, over 1,800 teenage girls became pregnant in 3 months, while data from Butaleja District Health Office indicates that 3,596 girls between 10 to 19 years got pregnant in 2019 and 3,633 in 2020. It is against this background that the Uganda Youth and Adolescents Health Forum, in partnership with Tororo and Butaleja District's health offices, organized capacity building trainings for the health workers on counseling, communication skills, and provision of rights-based quality adolescent sexual reproductive health services and information.
This training is very good for health workers. Most of what we are learning here, either by design, they're not part of our curriculum, or they are overseen. They overlook them during training, but you not find complete sessions on, say, cancer. And many of our health workers come out of training schools without that skill completely.
The training attracted 12 health workers in Tororo and 10 health workers in Butaleja, all of whom came from various government health facilities in these 2 districts.
The training that I've had to them, I've learned how to manage these adolescents, how to interact with them, how to communicate with them, because we have gone through communication skills, and also the services and the topics to give to them.
I learned about counseling. Like, counseling is a process whereby you help where an individual or a group of individuals who have an issue come out of that issue. Your work as a counselor is not to advise or to direct, but just help people to come out of it.
Adolescents have a different kind of way of communicating. So I've learned to communicate with them differently. Not like I'm going to ban them.
Following this training, the Uganda Youth and Adolescents Health Forum organized a series of young mothers forums on safe motherhood and facilitated by the trained health workers. The forums were held at Mukuju Health Center 4, Peta Health Center 3, Paya Health Center 3, and Sopsop Health Center 3 in Tororo, and Busolwe Hospital, Busabe Health Center 3, Kangaraba Health Center 3, and Budumba Health Center 3 in Butaleja. Young Mothers Forums are an innovative strategies used by Uganda Youth and Adolescents Health Forum to convene young mothers, pregnant girls, girls at high risk of early and unwanted pregnancies, and young fathers to understand key concepts of safe motherhood, ranging from family planning, antenatal care, health facility deliveries, postnatal care, safe abortions, breastfeeding, nutrition, sexual and gender-based violence, elimination of mother-to-child transmissions, among others.
The purpose of the Young Mothers Forum is to, 1, to make us understand, the youth understand safe motherhood, as in large. So as in safe motherhood, there are very many things that are concerned: antenatal preconception care, pregnancy, then family planning, postnatal immunization. So we needed to understand that.
The Young Mothers Forum is a very good network for mothers who have become pregnant too soon, where they meet as people of the same age and discuss various issues around early pregnancy, but also get ways of supporting each other to come to the clinics for antenatal and also eventually delivering at a skilled birth attendant.
The Young Mothers Forum brought together a total of 584 participants from the 2 districts, with 297 from Tororo and 287 from Butaleja, and these included both young mothers and young fathers. During the training, they learned about several key areas around reproductive health, including antenatal and prenatal care, postnatal care, family planning, post-abortion care, safe abortion, immunization, breastfeeding, nutrition, proper use of condoms, personal hygiene, menstrual hygiene, HIV and AIDS, STDs, and many other topics.
So today with the young mothers, we have been engaging them in a dialogue, and we're discussing challenges the young people face. We had issues of family planning, we had issues of antenatal, basically interacting with them, getting their mind.
What we have been discussed today, we talked about post-abortal care, preconception care, we talked about family planning, we even talked about antenatal care and postnatal.
The forum was so engaging as the participants shared a lot of issues, including myths and misconceptions around family planning and other challenges that they face as young mothers and adolescents.
During the session, the young youth or the youth, they raised the question, in the village, have been experiencing some false information about family planning or what we call contraceptive. They have been saying that we used to have, go to the facility and we use condom. At the end, we may be barren. Some were saying, if we use condom and it passes inside, we can cause problems and you die. So, which was the false information?
Like in family planning, they were saying, they were giving us the fears they used to have from behind about family planning. One, like, if I've not produced, maybe family planning cannot make me again get another a baby. Then on top of that, still they had very many myths on family planning. Like some methods can disappear from their bodies, like implanon, for example. Then IUD will be, like if they're having intimate with the husband, that the IUD will be tickling the man's penis. So those myths, at least today we have cleared to them and they were very happy.
Family planning, nali mmanyi nga mpulira abantu boogera nti bw'ogenda mu family planning ne bakuteekamu akaweta kayinza okukugulira mu mubiri.
Yeah, what I know about family planning. I thought family planning is only for married people. But when I came, I realized it can be used though you're not married.
The young mothers expressed their gratitude for the opportunity to learn and have committed to using what they have learned from the forum to improve not only their own health but also the health of those in their communities.
Now that I've learned about family planning, I'm going to finish producing my baby, then I use family planning.
Ebintu by'endise wano leero nina okubuulira bannanga abalala ne mbakakasa nti bye batugambanga tebiriyo okugeza nti ng'ogenda mu family planning breedinga nnyo.
And to also teach children, people that they village like us. I wasn't ready to get pregnancy. I will teach them how to prevent themselves from getting unwanted pregnancy, like using family planning.
Furthermore, the health workers were passionate about the forum and suggested that this training be made continuous so that the young people can continue to learn and improve their lives.
Secondly, for us as the Ministry of Health, the Young Mothers Forum is a good way to quickly tell the young mothers how to take care of their young babies when they come, but also give them options of child spacing and ensuring that they don't stop at this child or they lose a birth, they lose a baby because of delivering from an unskilled health worker.
When these things happen in this way, they're able to bring their challenges out and what they feel like it is important to them. So what I can recommend, we continue with such dialogues so that we learn more from them.
I call upon the government and also this forum to continue not to implement, because it has helped to put the youth on board. They've been staying with their problems, not sharing them. But today they are free and they are sharing, so that we get, not like today, we are trying to come and keep this contraceptive, the condom. But as we came and we told them how to use the condom, they are free. You know what? Use the condom and they picked them.
All right. That's a documentary that speaks to what we're talking about today, right? Yeah. So maybe now I will request my guests to return back to their seats. Thank you for I'm sorry for making you overmove, but we wanted to make sure that we give you an opportunity to watch that documentary to give you a perspective of what different groups of young people are doing in terms of engaging in the ICPD process commitments, in terms of providing information, creating opportunities for young people to access services, linking young people to services, but also working with healthcare providers to help them change their attitudes. I think with that, I'm going now to invite Dr. Betty on behalf of Dr. Jotham to give the NPC quick remarks. Yeah, thank you. Maybe as Dr. Betty comes in, join me to stand up and welcome the UNFPA country representative. Oh, yeah. Zoe, I think you will help me bring, I think she's actually the Honorable Betty to come and take her seat here. Yeah, Dr. Betty, I think you can proceed.
Thank you very much, Patrick and MC. I'll just beg for your indulgence, ladies and gentlemen, that I'll just come and deliver Dr. Jotham Musing's very brief remarks before I make the keynote address, so that we save on time. I don't have to speak now, then come back. So, Honorable Minister, please allow me just do everything in one. Thank you very much.
Great. So now I'm going to invite the young people's representative, Mary Chirunda. Mary, where are you? Yeah, to come and make your remarks. Also now, finally, Miss Mary is finally here, the UNFPA country representative. You can stand up and give her a big round of applause. Miss Mary Otenyo, welcome. You can have a seat. Yeah, take a seat. Yeah, thank you. So after Mary speaks here, we're going to invite the entertainment group to come and present for the minister very nice traditional dance.
Okay, good afternoon, everyone. I'm Mary Chirunda, a chain champion at Uganda Youth and Adolescent Health Forum. You're most welcome to the ICPD Youth Summit 2021, Uganda. The objective of this summit is to position young people as right holders. Yes, now we have a key message. What are some of the key messages that we can take home? As young people, we appreciate the government of Uganda for the work it has done to implementing ICPD25, but there is still a lot that needs to be done. However, the implementation continues, but still we urge the government of Uganda to continue implementing and with advocacy to achieve the SRHR services for young people.
Another thing is, as we all know, in 2020, COVID-19 hit our country. So by the coming of the pandemic, we have seen a lot of teenage pregnancies. Young people, mostly girls, have been affected and they have dropped out of school due to teenage pregnancies. But what can we do as young people to address such an issue? It is a key message that we should think about as for everyone in the room. Then another thing is, last week, the report came out indicating that districts with the different teenage pregnancy rates, and we all saw that most districts have high rates of teenage pregnancies. And the age brackets in these teenage pregnancies are girls who have been out of school due to COVID-19. This leaves a gap to the education system, and a question to very many of us as we ask by the year or by 2022 when the government hope to open up schools, shall we have girls in school or not? Then we can see many girls have been married off due to teenage pregnancies. Yeah, in most cases, in most of our cultures, when you get pregnant, you're expected to marry. They look at you as someone who is mature. So, due to inadequate SRA, HRA, and the bias at the health facilities, many girls have fallen victims of teenage pregnancies, which has led to remarriages or child marriages. Then we see that all this has been because of lack of political will from the government and the stakeholders themselves. They don't consider SRA, HR as an important issue for the young people. So as we live here, we request everyone, since everyone is a stakeholder, we should look at SRA, HR as a key issue to enable girls and boys in school. Then we shall look at what is the cost of teenage pregnancy. After this all has happened, what is its cost? And the cost of teenage pregnancy is mostly on the girl child. It has affected the well-being of the girl child. The first one is teenage mothers are more likely not to finish up primary school. For example, in villages, deep down like in Soga, you'll find that girls go to school when they are mature, when they are of an adult age. You might find someone is in P5, but when she's maybe 18, she's already sexually active. That girl is going to conceive. And when you give birth, it is really hard for someone to go back to school because, you know, there is a lot of stigma attached to it. Then another thing is these girls who get pregnant when they are still young, they are most likely to be dominant in the peasant agriculture. They will not be able to come on board and compete on the world market. So they will be confined in agriculture, which really earns little for them, for their well-being and for the sustainability of their families and the children that they give birth to. Then another thing is teenage pregnancy is responsible for 18 the annual birth deaths or infant deaths in the country. As you know, when you conceive when you're still young, your womb or your uterus is not yet mature to hold a baby. In that process, you might find that if the child doesn't die, the mother is going to die. And we look at the statistics, as teenage pregnancy alone, it contributes 18% of the infant mortality rate. Then, another thing is, youth need to be meaningfully engaged in policy formulation and implementation because there is nothing for us without us. You can't plan for us when we are not also planning because you don't know what we really need. So I call upon in your different departments and in your different organizations, if there is anything for the young people, please involve the young people themselves to speak for themselves. Even though you were a young person, that was then, but the era keep on changing. You might find that what you were experiencing during that time, the challenge you were going through, it is not the same challenge that young people are going through right now. So it is better you give them a chance, they speak out what they think would be the best way to address the challenges that they are facing. In conclusion, as young people, we are of the notion that everything planned for us without us are meaningfully against us. So we request everyone and the minister available to take this information to the government and to the right President Museveni that whenever they are planning, they should look at young people. Thank you.
So the young people have spoken. I will not repeat their words. Now I'm going to invite the entertainment group to come in and give a warm entertainment welcome to our guests. And then from there, we're going to listen to Honorable Chelaine Betty Lowuk. Yes, I hope I'm pronouncing your name well, who is a member of parliament and also sitting on the Health Committee of Parliament and representing Honorable Joel Sirikali, who is the Deputy Chair of the Health Committee of Parliament. So, the entertainment group, please. Are we ready? Or I was about to postpone you.
bageze kugarama mbona n'umurenzi wo kurwana muzima twakagira muze ngo bayanze gushira amakenga ati ndihera yabese atari icyogere mu kubona ko bintabaza nyiri kibazo n'iko niba ibintu bitagaragara ngo twakagira ingenzi bari abantu babo batabaza gushaka kutagira ibyo bakora aho
Thank you. Sorry, we have to cut you short, unfortunately. We are sorry. This is a very beautiful dance, but I don't know how they ended up presenting it from the other side instead of here. But they said they had so many formations and there wasn't enough space here. Maybe later we'll try to see how we can get them here by displacing this step at some point when they're doing the closing presentation. Once again, allow me to welcome Miss Mary Otieno. A very big round of applause for her again. She's the country representative for UNFPA. I know you're 1 month or a couple of weeks in office. 1 month in office. So, very interesting to see that you're starting with, as you start your tenure in Uganda, you're starting with this beautiful summit with young people. So we really hope that it's going to continue this way. And we're really excited. I've personally been reading a lot about your work you've been doing in South Sudan. And we hope that it's going to be the same passion here in Uganda. And of course, young people in Uganda are more exciting and more fun than the young people in South Sudan. So I think you see what we are doing already. So you're definitely going to enjoy working with us. Yeah. So now I'm going to invite Miss Betty Lauk. I have so many Bettys on the panel, so I have to be very clear on which Betty I'm inviting. Feel free either to use that mic, whatever you want. Okay. To just give your remarks on behalf of Parliament, and then we shall proceed. Thanks.
Thank you very much. Can I come and stand there?
If you want.
Thank you very much. The ministers around, invited guests, the youths, protocol observed. Good evening, good afternoon. How are you, members? The youth. I'm called Chelaine Betty Louke, Member of Parliament, representing people of Amudat in Karamoja region. I'm really glad to come here to represent my team, the Committee of Health. I'm here to represent the chairperson of the Committee of Health. When you see me here, see me as your fellow sister, your mother. I'm a mother. I have 3 children, 21 years, 15 and 8 years. So I'm a big mother, not a young one. So this is the big day for us today. The ICPD, this Youth Summit of this year, really have just come. And when somebody enters in a community, you first sit, you be welcomed, and then you see the environment. I've just taken short time, but I know next time I'll be able to come early so that I may be able to see what's happening. But all in all, this is Uganda, our country. We need to move together and plan well. We in Parliament, we are trying. We are just newly elected. We shall be there for 5 years preparing. I know some of you are warming because we were also youth. By the way, youth, do you know that one time you'll be somebody? Somewhere. Are you aware? Then you may utilize your life well. If it is time for education, put education to be the front of everything. Make your life be better in future. Some of us, we grew up in the village. Me, I'm a son of a peasant. My father did not go to school. Mama did not go to school. I just escaped all those calamities. And pregnancy, those things. Avoid them. They're not good. Are you people getting? Take this message. If you want to be a better mother in future or a better father, think of your education to be the first. We are sorry because of the COVID-19. It has really interfered with a lot of programs in this country or the whole world. We need not to blame anyone. This is world calamity. And we know it will end because everything has a period. Even in the Bible, it is written like that. These things come and they go. So the only thing is good we are with our minister here, and me also as the government. We shall take your message to the government and see what to do next. But my message is, because of the COVID-19, let us pray to God that the presidential message, which is, he said that by January schools will be open, and when schools will be open, please, God, think of your future. There is nothing which is not possible in this world. If me here, if I can give you my story, I come from deep in the village. I've been taking care of animals, cows, goats, with a lot of cattle wrestling there with a gun. But the government has taken it. So what I can tell you people, think of your education, mind so much of your future. You see these people who are sponsoring these occasions, they don't just do it because of what? Don't come here and enjoy. It is not enjoying. See, get the message which they give us from here. Otherwise, the dance which was here was so nice, but you know African culture, if you want to make the song so lively and enjoyable, you need to mix them. There were no boys there, see them? Were they there? As if they are only girls. All this meeting is for girls only. Adolescent mixture. So when you prepare the dance, you mix co. Otherwise, thank you very much. We shall be together. We pray together with you people. We shall stand on you and help you where it is necessary. Otherwise, thank you so much. Be blessed.
Thank you very much, Honorable Betty. And I actually was confusing your constituency with a constituency in Sebe, but now you've made it very clear in Amdat.
Okay, the thing is, my name is, I'm called Chelain. Chelain means a city, town, like Kampala here. But it's Amudat, my city. So we are Kalenjins by tribe, but we belong to Karamoja region. We are in Karamoja, but we don't speak the same language. We practice FGM, Honorable Minister. We cut those things. But nowadays, we are not cutting. Yes. Yes, in fact, to stop this, it is only education which can make it work better. But if you leave those guys in the community there, they will still cut. Because if you don't cut, there's nothing like marriage. And you know in tradition, marriage is very important. So if you are not cut, no marriage. That's why they are being forced. So the only thing is to pick these girls from the community and we take them to school. Then they can change the environment. Thank you.
Thank you. And we are also glad to know that you are a champion of anti-FGM. Yeah, I think this is your diary. Thank you very much for those remarks. Now, without wasting more time, I'm now going to invite Miss Mary Otieno, the UNFPA country representative, to give us her remarks. And we also officially, on behalf of all the youth in Uganda, welcome you to Uganda. Thank you.
So first, let me apologize. It is not in my nature to be late at all, if you know me. So today I was stuck in traffic for 2 hours, something I've not experienced since I came, and I've been here for a month. 2 hours in traffic. So it wasn't deliberate. I respect young people. and will be on time as I would with any other person. So I apologize deeply, really deeply. So let me first recognize Honorable Anifa Kawoya Bangirana. I hope I pronounced that right. State Minister for Primary Health Care, Ministry of Health. Honorable Speranza Baguma, former MP and board chair of UYAHF. The Honorable Chelaine Betty Luke, MP Amudat, and Dr. Betty Tiadondo, Director Family Health, MPC. I am so honored to be here, and first would like to say that I am here representing the Executive Director for UNFPA, who was invited, but of course she couldn't be here, so she sent me to give her remarks. So I will concentrate on the message that she wanted to pass to you young people. So that's what I'll do today. But I've only been here for 1 month and will be working with young people. I used to be in New York, for those who have heard about me, and I used to be in charge of young people. So this group is so dear to my heart, and I believe that every country office must really, really focus on young people, who are the largest demographic group in most of our countries. And we pay so much lip service to them in terms of investing and working with them. So I'm going to make sure that in our office, which is already doing wonders really in terms of young people, does even more. So thank you so much. So on behalf of UNFPA, I'm glad to be taking part in this ICPD Youth Summit, and would like to commend all the organizers of this event for their efforts. Now, I will not repeat the theme for you, but the theme really for this summit is in line with our strategic plan for UNFPA. And you know that we have 3 results that we need to achieve to contribute to the achievement of the ICPD. And one is ending preventable maternal deaths, achieving zero unmet need for family planning, and that also touches on the adolescent pregnancy issues that we are talking about. They are not planning their families, but they need to stop unintended pregnancies or prevent. And realizing zero gender-based violence and other harmful practices like FGM, gender-based violence, child marriage, and others that people have mentioned. So we are pleased to be working with you in this room to deliver these goals and to ensure that the country delivers on its ICPD commitments. Now, I don't know whether you remember this and what Uganda committed to. And Uganda was one of those countries that was actually represented at the highest levels. Your president was there. And he committed to some very progressive commitments, and I'll just read some of them. So Uganda committed to improving universal access to family planning, increasing resources committed to adolescent-friendly service provision. Uganda committed to allocate annually at least 10% of maternal and child health resources to adolescent-friendly reproductive health services, eliminating obstacles that stand in the way of girls' empowerment, including teenage pregnancy, child marriages, and all forms of gender-based violence. So this was read by your president to all the world for about 180 countries. So South Sudan was the newest country then, joining the 179, so 100 countries. Uganda also committed to operationalization of the National Sexuality Education Framework and increased investment in youth. So as a member of the East and Southern Africa Community on Sexuality Education, Uganda committed to ensure that that is implemented. So young people, you know your commitments, and as rights holders, we must hold our duty bearers accountable, isn't it? Yeah, so this is what we committed to as a country, and as duty bearers, but you're rights holders. So you want to make sure that you're following on these commitments. You must know them. Because if you don't know them, you cannot track them, can you? So you really must know what is happening. And then, I don't know whether you know this, but on the 15th of November, there was a high-level report that was launched. It's called the High-Level Commission on the Nairobi Summit on ICPD25. If you don't, please look for the report and read it. The report is entitled, No Exceptions no exclusions, realizing sexual and reproductive health rights and justice for all. You need to read that report. The High Level Commission is an independent advisory body of eminent leaders from around the world, which was formed to track progress on the 12 global overarching commitments in the Nairobi Summit and encompasses the 1,300 Nairobi commitments. And this report can count on you as young people to be part of its members to make sure that it's implemented and we track it. Note that this report says that there's a lot of progress, but it also says there's a lot of pushback on sexual and reproductive health and rights all over the world. And it calls on ambitious, deliberate, and comprehensive acts to achieve sexual and reproductive justice for all, in particular women and girls. So we are encouraged to see you today, following up on the commitments of Nairobi Summit and really advancing the agenda of the ICPD, making sure that we reach the hardest to reach and the most vulnerable people so that we can achieve our 2040 vision for Uganda, but also the 2030 SDG agenda. Now, the executive director had a few questions or concerns for us to consider, and I will read them verbatim. So she says, as we reflect on the implementation of the country commitments, here are a few points we may want to consider. What tangible ways can you, in your diverse capacities, further advance Uganda's commitment through the lens of the call to action and recommendations of the report, no exceptions, no exclusions? So go and read that report and see how you can advance this in your own different capacities and rights. The second one is, how are we able to amplify the messages of the report through our networks of like-minded partners as well as those who are yet to be reached? So how are we going to use our networks to advance these issues and to make sure we are tracking the implementation of the commitments? The other one is, how can we further collaborate with national partners, government and civil society who made Nairobi commitments centered around youth? How are we partnering, and how can we duty bearers help you to partner with us? The last one is, how can we augment opportunities for collaboration at the regional and global level to achieve our shared goals? So these are some of the things she wanted us to consider as young people. Now, as young people, you not only deserve, but have a right to have a seat at the table when programs and policies are being defined, agreed, and taken forward. This is a core tenet for us in UNFPA, and it's true even during the Nairobi Summit. Nothing about us without, but is that what you do, or you follow the duty bearers and, start behaving like them? No, young people have, authority, they have knowledge about what they as young people need. And if you don't engage us as duty bearers, we cannot help you. But you have to do it in a way that is professional, that has integrity, that is not adversarial, and then we will be listened to. But young people don't know that. Sometimes they think that you must be confrontational. But when you confront somebody, the person is ready for war, isn't it? So you must be smart in your advocacy, and we can support you to get these skills so that you're advocating and getting results. So UNFP is here to help you really get those skills if you need them. So as UNFPA, we believe in meaningful youth involvement and participation as a core principle in development. If and when engaged, young people have great ideas, are innovative, and can be agents of change. We are also cognizant of the fact that young people, to articulate their own issues and be able to demand their rights and accountability from us, duty bearers, we must invest in building your capacity. We know that. But you must also demand that in a right way and look for us and come and partner with us. So at the UN right now, the UN is working on a youth strategy for Uganda because we believe it's the largest demographic group and we must invest in it in order for us to achieve what is known as the demographic dividend. Who knows what a demographic dividend is? Have you heard of the demographic dividend? No? Who has heard? Please explain to them. Come and use my mic so that they can hear. Just to take 1 minute, I'm done. Yeah. Okay.
Thank you. I know us as youth, we usually belong to savings groups, not so? So I'll use simpler terms. Demographic refers to the population. Dividends, the economic benefits that we're realizing. So if I came to any savings group right now, and it's sharing what they've been investing, what they've been saving the entire time, will I be able to benefit from it? Will I?
No.
So it's the same thing with the demographic dividend. It's the economic growth that we shall realize as a country if we invest in the youth, firstly by ensuring that in line with us, the youth, we keep in school, have access to information and services, sexual reproductive health information and services, are economically productive, are skilled, but also we have supporting documents, good governance, supporting us to ensure that we are economically productive, we keep in school, and we have favorable economic policies in place. I can briefly term it as that. I didn't want to use a technical term,
thank you so
but
much.
technically, economic growth accruing from firstly rapidly declining fertility and mortality. That is very key.
Yes.
And coupled with investments in health, education, economic reforms, and good governance. Thank you.
I couldn't have done it better. She has simplified it to the core, that we must invest in young people's health, in their education, in their skills, and make sure young people are not marrying early, they are not getting pregnant, they stay in school, and their fertility is also not so large. Because in simple terms, a mother who has 10 children with the same economic status and a mother who has 3, whose children will be better off? It's the one with 3 children. So that is so simple in terms of spacing births and making sure you can only give birth to the children that you can feed, and they'll be healthy, they will not die early, but you're also not going to suffer from complications of being pregnant every year. So fertility decline is critical, mortality decline is critical, but investing in the largest demographic group is critical, because what happens when the population is young, you have a big base of young people who are not productive. So they are eating from a very small population that is productive. But you want these big young people to be the center of the pyramid, so that the ones they are contributing to the economy, and they are not dependents as they age and babies. But you can only do that if you invest in health, education, their skills, you have governance, things like family planning. And those are commitments that Uganda made. So let's follow that, and we are working with NPC, with UGOS on those. Uganda, I told them this morning we were at a meeting with NPC, is one of the countries that has really advanced in this area. So you should be proud of yourselves. But young people have to hold them accountable. You have to make sure they are investing in what they committed to. So with that, I just want to say that, I end with a quote that Kofi Annan once used: we don't need any more promises. We need to start keeping the promises we already made. So I'm glad that this summit is happening, and really want to wish you well, and know that UNFPA is committed and ready to work with you to make sure that we realize and achieve our demographic dividend, and that you reach your fullest and God-given potentials. Thank you so much.
Well, another big round of applause to Miss Mary. I think who likes a song called Kachumbari? Who would like to dance kachumbari right now? Eh? No one wants to dance kachumbari. Who wants to lead us in dancing kachumbari? Where? Okay, come here. And let everyone stand. Oh, okay, you can also come. Come. DJ, we have that kachumbari music. Yes. As the DJ, come close, and we're going to have everyone stand up and dance kachumbari to wake us all up, right? As the DJ gets us the music. Allow me to welcome two people within our presence. One of them is Mr. Eru Jacob. Mr. Eru Jacob, you can stand up. And they see you and wave to everyone. Eru Jacob is the chairperson of the National Youth Council. The National what? Youth Council. So if you didn't know the chairperson of the National Youth Council, here he is. And then also, importantly, I want to recognize another very important youngest adolescent in the room. Someone who has adolescents and young people at heart. Wait. When you say the word adolescent and youth, and you mention his name, you're making a repetition. You have to say one of the two. So, ladies and gentlemen, join me to welcome Mr. Mondo Chateka. You can wave to the people here. He's the Assistant Commissioner for Youth in the Ministry of Gender. He's one of us. He has been one of us, and he will forever be one of us. He's going nowhere. Thank you. So, let's all stand and first dance kachumbari, as then we invite Dr. Betty to make her remarks and presentation, and then we shall go to you.
Excuse me. Before you, my name is Nantawa Shamira Faith. I am the Miss Y Plus Central Region, second runner-up from UNIPA, and his son Jeremiah, also Mr. Y Plus Central, second runner-up. Thank you.
I am the Mr. Y Plus Central Region. Not first, not second. Thank you.
Kachumbari then. So everyone is going to stand, right? And we dance kachumbari. Those who can stand.
I say, oh, no, 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 no. Oh, no. Well, love you, tap, baby. How we feel like I really baby. Baby, no, no, no. Oh, no, you can't answer. Now, you tell me who could say, but then you came around, so you mean life saying I'm better angle. That you won't go walk down, you ask around there, you are the reason. I said, David, she told me I got somebody. So money they have what you say what you and I'm got to see. I let me come and be so deep. So money they have what you see what you. Just fire, I couldn't resist. No, I couldn't resist. When I'm love, I know I can't resist. I'm beautiful, I couldn't resist. No, I couldn't resist you, baby. You losing, you come get you. Names and you, ain't got just you, but the scenario. It's been a long time since we met, but I still love you like before. And when you're not around, I still drop you on the low. But the way you sit on that border, yeah, that way you're a stranger. You don't know, but it feels me inside. The way you sit on that border, and you're holding a stranger. You don't know. I said, David. She told me I got somebody. Somebody have a thing. Me say what thing. And I'm about to see. I let me come and be sorry. Somebody have a thing. Me say what thing. Oh, my God, your body was just fire.
Thank you very much. A very big round of applause to the young people. And then a very big round of applause to the biggest challenger in the room, the Honorable Minister. If you think you can challenge her, prepare yourself, Nae, you'll be in hot soup if you think you can challenge. Thank you. Now, we're going to invite Dr. Betty, who's going to make her presentation. But as Dr. Betty comes, allow me to briefly say that for our guests who are here, we've been here since morning, and what has brought us here is briefly about like 3 things. One, we wanted to reflect on the ICPD commitments, because these commitments are very, very important to the health of young people. And we also wanted to know how far has the government of Uganda gone in implementing these commitments? What is being done? Because there's so many incredible things being done, including, like, for example, we saw the law campaign on ending teenage pregnancy, defilement, and other things. We have seen rolling out of sexuality education in schools. We have seen, family planning services being made available at health facilities and other things. But notwithstanding, we've also seen many other challenges that young people face. So we wanted to give our experiences in terms of what we think. And this morning, we've had a panel of young people who are able to share experiences. And on the panel, we had young people representing refugees from Chaka too who were here, young people living with HIV, represented on the panel and sharing voices of young people living with HIV, young people living with disabilities. We're also here sharing experiences. Young mothers, we just watched a very interesting documentary on the challenges that young mothers face. So we are trying to, address the issue from all angles. And we also broke into groups and tried to discuss key things that we need to do going forward, because we cannot just let the implementation of important processes like ICPD commitments, the Family Planning 2020 commitments, the Coastal Implementation Plan for Family Planning, the Reproductive Maternal Newborn Child Health Sharpened Plan. We cannot only leave it to government, we also must have a role. So we were discussing things that we need to integrate into a roadmap. And this is going to be a youth roadmap of interventions and activities that we're going to do. And we also selected a steering committee that my colleague Ben is going to introduce at some point. Steering committee, because we want young people to be very organized. If you invite them to Ministry of Health to come and participate in Ministry of Health processes, to have leadership that can guide them. We have very many opportunities. Ministry of Health, Ministry of Gender, Ministry of Education have been, for example, reaching out to us as you are, inviting us to deep policy-making spaces. But we don't want to see Patrick there, because Patrick is growing old, or Patrick is me, by the way. We want to see these young people themselves, 22 years, 19 years, 20 years, 23 years, being in the room, being part of the conversations, and contributing to those conversations. So we're going to have a roadmap. Someone is going to share some of the key highlights of that roadmap, because we want the Honorable Minister to know those key highlights in the roadmap. And then when she goes back, she tells her people in the ministry to support us as we implement that roadmap. So basically, that's what we've been doing here. And also importantly, among us, we've been having one of the beauty queens in Uganda. We had 2 beauty queens here. The Miss Y Plus beauty queen for Central Region, who just danced for us, Kachumbari, and one of the former Miss Uganda beauty queens, I think a second runner-up, first runner-up. Yeah, Mary, you can stand up and they see you. So we are quite well represented in the room. I just wanted to make sure that I give that update for you to know. Dr. Betty, you're welcome.
Thank you very much, Patrick. The Honorable Minister of State for General Duties in the Ministry of Health, Honorable Hanifa Banjirana Kawoya, the Honorable Cecilia Shelane Betty Louke, my namesake from Amdat, Honorable Esperance Baguma, who is also a very good friend of mine, and the representative of UNFPA in Uganda, Madam Mary Otieno, the representatives of all other development partners, colleagues from government ministries, departments and agencies, the academia, and of course the young people who are beneficiaries of today's dialogue that we are having. You are sexual reproductive health advocates from different consortia. I heard when Patrick was introducing you. It is really, really a very big opportunity for the National Population Council to be part of this dialogue and deliberation. I think when we were planning, we called it intergenerational dialogue. When I came here, I found it is a summit. So I don't know whether the two are interchangeable or they mean the same. But nonetheless, allow me in very few minutes to say that I'm going to give you remarks from my boss, Dr. Jotham Musinguzi, who right from the start loved to be part of this event. But unfortunately, you all know what happens towards the end of the year. We are closing the year, we are closing the work plans, we are planning for the next year. Has not been able to join you, but is definitely with all of you in spirit. So today we mark the beginning of what we want to do as we walk the journey towards achieving the commitments we made in Nairobi. So many things have been done, and as I make my presentation, I'll tell you some of them. But it is important for us to understand that we meet and fulfill the commitments that we made for the good of the young people of Uganda. I would like, first of all, to congratulate all the young people who are here for ensuring that you come up to have this wonderful discussion. And as one of the organizers, allow me to sincerely thank all of you for this very active participation. I can see when Patrick is speaking, he's just thinking about the young people. He's dreaming about the young people. I'm sure even as he sleeps in his dream, he wakes up and thinks about what next to do and what next to, or who to engage, or who to run to. So it is very pleasing that we see this momentum continuing and it is not dying out, despite what has happened over the previous 2 years. I'd also like to express my gratitude to the Uganda Youth and Adolescent Health Forum that have been continuously engaging and implementing in these events since we had the first Nairobi Summit in 2019, when again, I think it was UWAF that led the organization of that pre-youth Nairobi ICPD Summit. So UWAF, we really appreciate the stamina and all the efforts that you're putting in organizing and bringing young people to dialogue on these issues that are pertinent to the development of our country. Allow me also to appreciate United Nations Population Fund, the country office, that have continuously supported. And we could clearly hear in the message of a representative that without youth, we are not going to achieve all our development agenda. So, Honorable Minister, everyone knows that the COVID pandemic has dramatically changed the world. And I don't want to go into the details that schools are closed or SRH issues are getting worse. But we know that the 2019 summit was a springboard for governments and other organizations to announce their commitments. And in my presentation, I'll touch on these commitments, but I also know that the representative of UNFPA has touched a number of them. And indeed, these commitments are important and should be continuously addressed. We need to monitor them. We need to ensure that we provide accountability, so we need to evaluate them. And the biggest chunk of commitment speaks for the young people. So we cannot achieve these commitments if we do not engage with the young people. So working towards achieving the universal access to reproductive health, even in the context of a pandemic, and preventing unintended pregnancies is one of the most fundamental and cost-effective ways to achieve sustainable development. So over the past 2 years, a lot has been happening, but we know as government, we remain committed to ensure that we realize these commitments. And once again, I would like to thank all of you who are involved in the different partnerships, in the different collaborations, and who have participated and are making a renewed effort to support youth sexual reproductive health and development. And we look forward to working with all of you in the implementation of the Nairobi commitment of the ICPD. So those are the remarks from my boss, and I'll straight away go on to make the presentation. I'm going to be very fast because most of the things that I had put in the presentation, you already know. You're the converted youth population that we have, but we also know a number of the youth that you're representing are not in this room. Actually, allow me also say, for the past, I think, about 2 weeks, or is it 3, I have been moving around this country with the youngest person in the room, the Assistant Commissioner of Youth, Children and Youth in the Ministry of Gender, Labor and Social Development, trying to, engage in dialogues with the different leaders at regional level. So we started off in Jinja, then we came back towards Kampala, but in Mukono. Then we traveled to Tororo. But before that, the weekend before that, we were together in an inter-university dialogue, still talking about these same issues. I think it is high time we stopped talking and we actually started realizing the change that we want to see. So in terms of the role of ICPD 25 commitments towards the realization of young people's sexual reproductive health in the face of a COVID-19 pandemic, I have already said I'm going to be very fast. Uganda's population is very young. 54% of Ugandans are below 18 years, and about 70% are below 30 years. And if we don't make any investments in this young population, then we are not going to achieve the demographic dividend that my colleague Zoe described, and she has never done that at NPC. I don't know why she always uses the complicated terms, but it was very, very beautifully explained. So why are we having this very young population? The biggest issue, again, she touched it in trying to explain what the dividend is. Uganda's women are very highly fertile. We are fertile, but keep in your mind this map, because I'm going to keep referring to it all the time. So Uganda's population has women that are highly fertile, but the fertility is different in different regions of our country. You can clearly see, I'm not going to go through all of it, but where you see the darkest patches, those are the districts that have the highest fertility rates. Where you see the very light colors, I don't know whether that is yellow or, you know the colors better. That is where we have the lowest fertility. And what is the cause of this fertility? The next slide, please. The cause of this fertility is because of reproductive life of our adolescents. The young girls in Uganda start giving birth when they are babies. They give babies when they are babies. They give birth to babies when they are babies themselves. I have told you I was traversing the different parts of this country. On Friday, I was in Kamuli, and I was a little bit disturbed because there is a network which is attached to Chambogo University, Honorable Minister. This network is called the Demography and Reproductive Health Network. It was launched on Friday but it has been doing some work in Kamuli, Butaleja, and the districts within Busoga region, and they were launching their project. And what they did is they mobilized the people that we are talking about. They mobilized the young girls who were either pregnant or who are mothers. And the mothers, the pregnant mothers, came along with their babies. So when I got to the venue, I looked around, and I thought the mothers were the ones sitting at the back of the tent. And then I was called to move to the front and take my seat. And then I realized even at the front, we had these young girls. It was a little bit disturbing because what I know in my culture, when a girl gets pregnant when they are young, they are hidden somewhere. Either they will take an abortion or they will give birth, and we shall not even know about the birth until the baby is grown. In this community in Kamuli, girls were openly moving without any shame or fear with their pregnancies or with their babies. Some of them are 13, others are 14, others are 16. I had an interaction with them, and it was such an appalling situation. We are talking about these numbers in graphs, but the reality is not seen when we sit in the hotels. The reality is in the communities. And unfortunately, when these young girls engage in sex for the first time, they don't use contraceptives. They only use a contraceptive when they already have the number of children that they cannot take care of. And this is where the population challenges and the call for the ICPD program of action is stemming from. The next slide, please. And because of teenage pregnancies, well, we haven't been changing so much over the years. In 1990, the teenage pregnancy rate was 45%. In 2000, it had come down to 31%. I don't know what magic was performed during those 5-10 years to reduce from 45 to 31%. Then we reduced from 31 to 25% in 2006. And we have failed to make any additional step from that time. So what did we do between the 90s and 2006 that we cannot do now? We need to find out what happened during that time so that we address this issue very squarely. Next slide, please. So when we talk about teenage pregnancy in percentages, the figure does not resurrect so well within our minds. So we also have, with support from UNFPA, used the statistics from the health facilities, the DHIS2, and have put the numbers to speak for the teenage pregnancies. So we can see that the teenage pregnancy rate has been stagnating at about 350,000 every year. And if you can show the next slide, please. So this 350,000 means we have about 30,000 teenage pregnancies every month. Or we have about 1,000 teenage pregnancies every day. Oh yeah. Uganda registers about 1,000 teenage pregnancies every day. Young people, this is a challenge. This is a very big challenge, and this is what we are speaking for when we talk about the ICPD commitment. So, the next slide, please. So when we talk about the numbers, I have put a list of some of districts. So on a daily rate, for example, in Kamuli, we have about 18 teenage girls getting pregnant. In Kampala, which is more urban, we have about 24 girls getting pregnant every day. And when we were in Tororo, one of leaders, I think he was a chairman, said this simply means that Uganda is closing 2 schools, 2 government schools, with a population of 500,000 students on a daily basis because of teenage pregnancy. because an average secondary school, rather an average primary school in the district is about 500 pupils. And this is both boys and girls. So when we talk about the teenage pregnancy rate on a daily basis, we are closing about 2 schools full of girls who have become pregnant on a daily basis. So ladies and gentlemen, this big challenge of teenage pregnancy is giving us something that is not desirable for this country. It is giving us a population age structure that is predominantly full of young people. And it is for that reason that Zoe explained that we cannot achieve the demographic dividend unless we focus so much on changing this population age distribution, and we have, instead of having more people in this rate, we reduce the number in this rate and have more people who are working to support the young people. But for as long as we continue having more young people here and few people in the working age population, then we are not going to make any savings, we are not going to make any investments, and we are going to deny the country the opportunity to harness the demographic dividend. The next slides I'm going to skip because they are describing the commitments that His Excellency, the President of Uganda, read at London, rather at Nairobi. So whoever is moving my slides, please skip the next 2. Skip the next 2 slides, please. And the next one. So what have we done in terms of supporting the implementation of this commitment so that we can be able to achieve what we have committed? Number 1, we have facilitated continued policy dialogue and reflection on the commitments. And I think this is one of the opportunities that we have. I know when we came from Nairobi in 2020, we held a post-Nairobi, what did we call it, workshop. And we invited the different ministries because ministries committed. We invited the civil society organizations and what had they done in terms of helping this country achieve the commitment. So we have continuously engaged through advocacy. We have tried to mainstream the commitments in national development planning processes. We have identified and engaged with both state and non-state structures. And we have identified the key advocacy and issues and provided support for their integration. And we have also engaged in key national planning processes at both policy and also at development plans. We have continuously reviewed progress towards the national commitments to generate evidence, and we have invested in capacity development, building the capacity of leaders to be able to support the implementation of these commitments. Next slide, please. We are also influencing through thought leadership, building capacity, but also engaging with policy and decision makers so that they take these issues seriously and support them with finances. One of the challenges we have is ensuring that the financial commitments are realized. But then we also look beyond doing business as usual, but tap into opportunities to realize these commitments. One of the things that has opened our eyes to what we must do differently is COVID-19. With COVID, we have learned to do, not engage physically, but online. We have used more of our names, social media channels, the Twitter, the what, to reach out, especially to the young people. But what have we seen in terms of our commitments? Our first commitment was integrating the demographic dividend priorities in the Human Capital Development Program of NDP3. And we have mainstreamed the demographic dividend as well as sexual reproductive health, gender-based violence, youth empowerment interventions in the third National Development Plan and into most of the programs of this plan, but we have also ensured that there is support in terms of finance for these issues to be grounded in the communities. Then the other thing that was related to human capital development was we agreed that we are going to have an innovative fund to support innovation, production development, and commercialization. And indeed, youth initiatives and incentives have been prioritized in the third National Development Program. And youth have been supported to access finances to undertake small and medium-term enterprises from microfinance and the Uganda Development Bank. Next slide, please. Can we have the next slide, please? Oh, it's a delay. Oh. So we have also, okay, so in terms of also for human capital development, which was our first, we committed to ensure that business, technical, and vocational education and training is instituted to give skills to the young people, because we realize that school dropout and transition rates are very low. So the Ministry of Education and working with the Ministry of Gender have modularized and rolled out the BTVET curriculum based on what we call the qualification framework, so that even if you joined an institution and you dropped out, you would still at some point go back and pick a skill. And that is what we want in terms of economically empowering our young people. Then we have supported TVET institutions to effectively collaborate with the private sector, so that this collaboration will enable the training institutions to identify what is available within the job market. Because at times we train, but then when the trainees leave the institutions, they cannot find jobs. Then we have also looked out for what are those highly productive sectors, which are construction, manufacturing, agriculture, gas, hospitality, and tourism. And we have supported and ensured that those who are doing the skilling can go and have training in these particular sectors of development. Then in terms of adolescent reproductive health, the commitment was to allocate 10% of maternal and child health resources to adolescent health. As we speak now, only 4% of RNMCH budget, Honorable Minister, is allocated to adolescent health. But we continuously fast-track the adolescent and school health policies, and we are hoping that by 2022, these policies will be approved and will be in place and will be supporting the issues for sexual and reproductive health. But we have also fast-tracked the revised RNMCH investment case, which uses the results-based financing through the GFF to support an increase for adolescent sexual reproductive health information and services. Then in terms of eliminating gender-based violence and teenage pregnancy, Honorable Minister, we committed to reduce the teenage pregnancy rate from 25% to 15% by 2025. And we are mainstreaming gender in all medium plans and annual budgets, and we have built capacity of local governments on gender-responsive planning and budgeting. We are fast-tracking the National Sexuality Education Policy Framework. I'm sure you are aware that this faced a bit of challenges from the religious leaders. We are having a number of mass media advocacy campaigns to address child marriages, and as well as women empowerment to increase the potential of our young people to make meaningful decisions of their reproductive lives. We are promoting menstrual hygiene management in schools and communities, and we have created gender technical working groups within the Human Capital Development Program to effectively integrate and coordinate the reduction of teenage pregnancies and gender-based violence. But in Patrick's remarks, he's also talked about the national campaign for reducing teenage pregnancy, defilement, child marriages, which has been codenamed Protect the Girl, Save the Nation. Then in terms of increasing universal access to family planning, there is support towards the commodities, ensure improved family planning method mix. We have support to strengthen the capacity for the public and community-based service delivery points to provide family planning services with the idea of improving self-care on a countrywide basis. Then there is increased deployment and retention of critical cadres. And we are also working with districts to formulate their district-specific family planning costed implementation plans so that they can tap into the PHC grant that the districts receive for implementing the health programs. But amidst all this, we have been faced with the COVID-19. And the COVID-19 has shown us that it is difficult to provide these services within pandemics. So we have seen an escalation in teenage pregnancies and sexually transmitted infections. We have seen an intensified gender inequalities across the regions, especially for the young people, and these inequalities are very obvious. Where we have seen high fertility, we are seeing high rates of gender-based violence. We have also seen impacts on girls' access to opportunities and access to improve their lives and ultimately on their education, but also economic potential outcomes. I'll not go through the next slides. I'll just want to speak about the last bit of my presentation. So what is the role of the youth in all this? Because we are continuously seeing inequalities in sexual reproductive health, inequalities in accessing services, inequalities in education attainment, in the economy, in employment. But we are aware that to achieve the ICPD commitments, we must put in place strategies to address these widespread inequalities. So what can the young people do? We need practical strategies for meaningful youth engagement and participation in the ICD program of action. And these have come up repeatedly, so I'll just summarize them. We need to support youth leadership. And for me, I'm very happy that you're establishing this, you've called it a steering committee, to support, to grow the potential of youth as leaders, to speak and engage with us at different levels. Then we are making a commitment to discuss and dialogue and agree upon the different roles and responsibilities. Because many times youth will come and say, you haven't engaged us, you have left us behind, but we also do not know how to engage. But with discussion and dialogue, I'm sure we shall find ways on how to engage. Then we need to have clear methods for addressing and responding to feedback. What is it happening that side? What is happening this side? So that it is a dialogue. It doesn't mean that for you, you're taking too much and you're giving us less. And then create and identify opportunities for youth and support them to be very good advocates. And I'm happy that in this dialogue, we have representation from Parliament, we have youth representation from the National Youth Council, and we have the young people sitting around here. Then we need to provide youth with sufficient support and resources. And very, very big thank you to UNFPA for ensuring that this support is always available. So ladies and gentlemen, allow me to stop here. Patrick took up a lot of our time, but he has told me I have only 5 minutes to make a keynote. That hasn't been fair, but I hope I've been able to deliver the message within the time that I've been allocated. So thank you very much and wish you all the best as you move forward in implementing the ICPD commitment.
Big one actually to Dr. Betty. Thank you very much. Now, that was indeed a keynote address. Apologies for taking up much of your time. But you did a good job even with the little time that you had. It was so rich. And we're going to make it available to everyone here when we are sharing the report. Yeah, now, we are moving on well. Now, before I call in the minister, one last thing that we're going to do, before I call in the minister, I'm going to invite the representative of the young people who's going to read the priorities for the roadmap. And then also, Hillary, can you come here with your committee, the steering committee members? Please come here. Please come very quickly and prepare the names is John Patience, Shakira Namudu, Natamba Shamira, and Joash. Yeah. So these are the members of the steering committee. Please use 3 minutes because the minister wants to give our remarks.
Thank you so much, Patrick. Good afternoon to you all. My name is Noamanya Hillary, and Youth Advisory Committee, SRH Alliance event. These are our priorities and the national roadmap accelerating ICPD 2025 in ICPD 25 in 2022. And our first group is adolescent-specific ICPD 25 commitments. And our number one priority is zero unmet need to family planning information with emphasis on appropriate and relevant information for the young people. The stakeholders we want to engage are Ministry of Health, local governments, civil society organizations, young people ourselves, and the media. But these are the barriers, and we have health workers that have a negative and judgmental attitude towards young people who go for SRHR services, and by this they always cause young people. They always create stigma when it comes to young people to access family planning services. And our strategies are online engagement, behavioral change advocacy through social media, through media and CSOs. Priority 2 is zero sexual gender-based violence and harmful practices. And our stakeholders we want to engage with or want to involve are Ministry of Health, the young people ourselves, the media, both stream and social media, CSOs, and local governments. Our actions are sensitization and promotion of positive culture, engage stakeholders within the existing communities, or community culture, or communities. We are meaning the religious leaders, we are talking about the cultural leaders in communities where we come from. And our number 3 priority is investing in education, young people, and media. What we want to see achieved by the end of year 2022 is elimination of sexual and gender-based violence and have a universal access to SRHR and family planning information and quality services. By universal access, we mean services that are relatively cheap to our costs as young people that are not high. And what we want to see achieved by the end of year 2025 is zero unmet need to family planning services and eliminate maternal death. Our second group is it is commitments, family planning 2030 commitments, and priority 1 is ensure contraceptive commodity security, actions, quality family planning with less side effects, build the capacity of health workers to manage side effects by the end of quarter 3, 2022, keep records on stock, public, private, and partnership, scale up and total market approach by quarter 4, 2022. Priority 2 under FP 2030 commitments is policies are restrictive. e.g. abortions. Actions that we want to take is increase funding of adolescent and youth sexual reproductive health programs, involve parents on SRHR issues, advocacy, strengthen youth partnership or participation. Priority 3 is meaningful youth participation in coming up with policies. The barriers are negative attitude of health workers towards adolescent and youth, young people, sexual reproductive health, and negative social norms. The actions that we want to take are build capacity of health workers to improve attitudes towards adolescent and young people's SRHR, scale up SRHR services to the grassroots, build capacity of health workers to side effect management. Group 3 is FP 2030 Costed Action Plan, and the priorities are priorities identified: strengthening the healthcare system, strengthening the supply chain, financing that is allocated to youth-sensitive issues, quality of the services, to reduce inequalities and achieve universal access to service and information. The goal is to increase the prevalence modern contraceptive use from 30.4% to 39.6% by 2025, and reduce the unmet need from 17% to 10%, and reduce teenage pregnancies from 25, that we believe it is no longer 25, to 14% by 2025. Actions, strategies identified: engagement of young people in decision and policies. Accountability should be provided by Youth Forum in Parliament and the National Youth Council in implementation of the policy. Empower policymakers with more information about the policies that were drafted. Involve the cultural and religious leaders in deconstructing the harmful norms and practices. Engage cultural leaders in implementation of interventions that address SRHR issues among young people in the communities. Create awareness by engaging local and cultural leaders. We should reach out to the diverse groups in the hard-to-reach areas with sexual reproductive health information. Sexuality education in schools should be rolled out, using media to increase coverage and orient the entire youth structure to the young people's SRHR. Barriers identified: sexual reproductive health and rights information is not reaching those in the hard-to-reach areas, so we need to portray this information to those who are green about SRHR, including policymakers. Meaningful youth participation is not being prioritized. Passing and implementation of policies that were adopted is being delayed. Funding of issues around SRHR government, financing of issues around SRHR government is focusing on curbing COVID-19 and not financing young people's adolescent health needs. Cultural and religious beliefs on contraceptive use, which hinders uptake of these services. Implementation of the enactment of policies. The government is looking at foreign funding to finance adolescent reproductive health and unemployment of fueling SRHR issues. If young people can afford to the services they need, they would not rely on the health centers. Thank you so much.
All right, thank you very much, Hilary, for presenting the priorities of the roadmap on behalf of the young people. Now, we're going to enrich this roadmap. Today we've got the priorities. We're going to sit down and enrich it, give it more fresh, and produce it in a very nice pamphlet like this. And then next year, before March, we're going to launch it. And we will invite you again to officially launch it off. Now, we're going to be inviting the Honorable Minister. Honorable, when you come, you're going to play 3 roles. Number 1, you're going to give your remarks. Number 2, you're going to launch the ICPD Youth Position Paper. Officially now, my team, you can distribute the copies around the room. And Honorable, I think you have your copy already for the launch. And then number 3, you're going to help us award our 5 outstanding champions for advancing adolescent and young people's sexual reproductive health and rights, accelerate the ICPD promise by giving them their certificates. So without further ado, allow me at this moment to invite the Honorable Minister to give her remarks and play the roles that we've requested. Thank you.
have seen what I've done. You have seen? I repeat. The representative of the chairperson of the Parliamentary Committee on Health, my good daughter, Betty, the deputy chair of UYAH Forum, my very long, nice and comrade, Honorable Baguma Otieno, my good daughter, the representative of National Population Council, my son, Patrick, whom I had a nice engagement with this morning, and we are very keen on the young generation issue. Officials from the Ministry of Health and my senior son from the Ministry of Gender, whom I've seen you for some time now, and I'm happy you are not growing. Other officials from the ministries and departments and agencies present here, the different representatives from our different partners, civil society, culture, and religious leaders present here. The reason why we are here, the young generations, all protocol observed. Good evening. And I think I'm the right person to have been invited here and to appear here. But first of all, let me bring warm greetings from my Senior Minister of Health, Dr. Jane Acheng. She's a mother, she's with you. She would have wished to be here, but because of other duties and knowing that I'm the right person. And when you're the right person, you definitely nobody takes up. I'm very happy that unfortunately I will not take long as I expected to do, because I didn't intend to come and read a speech. I intended to come here and we share out my experience. First of all, I'm a very strict disciplinarian mother. You are safe when your neighbor is. When you see your neighbor is not having a mask on, you are not safe. That's the starting point. All of us are safe when our neighbors are safe. This is the time of COVID. We started in the first wave, none of us knew what was happening. And we took it as business as usual. We went through it, lost lives, government, the minister, and everybody was not prepared. And I want to thank all our partners that came up to give us support to go through it. I need a mask on for me to be safe. Safe at my age. For you, you have a young blood, my dear. So I want to be safe when my daughters and sons are safe here in this room. Thank you so much. And when you are not putting on that mask, you are putting your neighbor to a risk. And we are here. The third thing, fourth of what I'm supposed to do is to launch you to be our ambassadors as we go out there during these Christmas festivals, to tell everybody to observe the SOPs and to be vaccinated. So when I start with this information from here, sincerely speaking, I'm talking to the right people and according to the realities that have been read here. One of them is to create awareness for our younger generation. I'm saying I'm the right person here because Patrick said most of you, and I can testify as I see you before me, by 1994, during the time of the KAI, where 179 governments, including the government of Uganda, appended their signatures and commitment for the ICPD, you were not there. So I'm happy that you have walked all this journey to be here now. But the good thing is that by 1994, I was there. And I was already a politician. Think about it. I was already a member of the Constituent Assembly. The one which ushered in. Yeah. So that's why I compete with you in everything. In Kachumbari, you saw me. You start again here. Why? You must have a vision as a young generation. You must be focused. You must be determined. You must ensure that you achieve that dream. Dreamers are achievers, achievers are dreamers. So if I did not go through all that has been talked to you, I would not be here. I'm your role model. 1994, I was representing Masaka district, 32 sub-counties. I participated in the promulgation of the 1995 Constitution, which ushered you the rights as youth council, as the youth, and my youth affirmative action for you to participate in this country. So why don't you say the government of Uganda, with the wise wisdom of His Excellency President Museveni, we did our best. That was the best achievement. The Constitution of Uganda on the African continent is the first one to be affirmative, that cares about the youth, the women, the underprivileged people. So I am happy that today you are here to look at the far and the journey where you found those who started before you. And now this is the time for you to take lead in ensuring that you usher in a healthy generation, healthy society, people, a generation with healthy minds, healthy economy. If you want aim our country's economic acceleration, growth, we must have a healthy generation. And I want to thank you that you are here to plan and you have already made your own commitments. I thank you so much. Having said that, I don't think you will get out of this room. I'm very extremely, very observant. Since I came in, no one has walked out. No one. If you have walked out and want to challenge me, put up your hand and tell me where you went. My eyes were there, unless you disappeared among the different tables. I have been very observant that you took keen interest in what you are doing today. I have not seen many of you engaging into talking. I only saw one table, but later I think they were discussing. So that tells me that you are keen, you are the right people, you are interested in what you are doing. When Patrick said that they have given you a lot of food, I looked at those with my tummy, I found that your tummies are lacking something. But it is good to concentrate. So I am happy that you are taking seriously why you are here, and I know when you walk out, you are definitely going to walk out as a changed person. So I'm very happy for the presenters, and I want to thank you for those good, well comprehensive, well documented, factual, and that your presentation was accountability and a commitment to the younger generation, those who are here present, those who are out, of how far since the Nairobi ICPD25, the journey you have walked. Thank you so much. I want to thank my colleague, Member of Parliament, for the Committee on Health, which is a supervisory committee for our ministry, the journey we are working together, and all our development partners. My daughter, the vice chair of UIHF, I know you were one of our chair in WOPA, and you pushed a lot of these issues concerning the generation. I want to thank you and still commend you for a good job well done. Now, I must remind you also that, as I've said, it gives me great pleasure to preside over this occasion of the post-ICPD25 National Youth Summit 2021, which is organized by the Uganda Youth Adolescent Health Forum together with UNFPA. And as you know, in 2019 at the Nairobi, as I have said, summit, many people walked all the way, many thousands around the world, marched together in solidarity to ensure that they will commit themselves to the commitment to ensure that all the youth, and I'm saying all the youth globally, they will have to adopt the landmark program of action as committed during that summit. The world convened at the ICPD summit in the belief that good progress is not good enough. The youth, you have talked, and you have been talking, and I'm happy my daughter said, the country representative, you may want to talk and overtalk, you want to demonstrate on the streets, but at the end of the day, you go home when you are tired and you have not achieved anything. Dialogue, as the Beth said from National Population Council, sitting here together and we look at issues, both of us, all state partners, it will help us to solve the issues outside there. It will help us to walk the talk. It's time to walk the talk, it is not time to talk, and it is the time to work together. When you want to succeed, you leave others behind. If you want to achieve your dream, you continue dreaming alone. But if you want to achieve and to become an achiever, move together with others. And that's why I commend you. Because you are not here in your own individual capacities, you are representing the other rest of the generations outside there. And I highly commend you. The Uganda government has made incredible gains since then. But too many people are still being left behind, as the presenters have shown you with the statistics around. And many nations have not been able to fully reap and demographically divided because young people and other groups still lack education, access to critical health services. Our sister and daughter from the National Population Council, she has shown that inequality, the gaps between the generation, young generation, and the other generation, the inequality gaps need to be filled. And she has shown you in most of the sectors. And they cannot be filled without your participation. That's why I'm happy that at least the priorities that have been read here and the achievements so far. You know, government cannot work on its own. That's why we have development partners. That's why we have country representatives here to help us achieve our strategic plan. Yes, we have a strategic plan, but we cannot walk the talk alone. We cannot achieve all that we have planned without our partners. That's why they are called development partners, to walk with us the journey to ensure we also develop and reach where they have reached. So we want to thank them, and we are happy for the support that they have been giving our country, Uganda. Thousands of women and girls still die in pregnancy due to preventable causes. Girls are still married off as children, and many more undergo female genital mutilation. I'm happy to say I was then the chairperson of a committee I initiated in Parliament, which is Equal Opportunities Committee. And together with Honorable Dr. Valiomus, we had to move to ensure we present private members' bill on FGM so that it is outlawed. As a government and the sector, we are also very concerned and worried about the rising rates of teenage pregnancy. I am happy we have many young boys here. When I say boys, now the language is one, the girl child and the boy child. So me, I'm a girl child. Don't say you are old woman. I'm the girl child. And my friend, the assistant commissioner, is the boy child. So we have been for a long time as government and globally thinking about only the girl child. And I'm sure it is high time we started really considering the Patrick, the boy child. The girl child is the victim. The boy child is the you have heard it. The girl child is the victim. Now, when we are looking at these pregnancies, think in your own mind. You saw these young girls there, feeding, pregnant, life going on. So when I looked at the video, inside myself, I felt so sorry and my heart was bleeding. I turned around and I looked. Whenever I could see a girl with a baby testifying, then I would look around this store and I said, that one is the age of the other one. You can imagine. Their future totally stopped there. And who are the culprits? The boy child. And I'm seeing some of you, and I'm happy, who are about to be culprits today. But thank God you have heard the message. You see? The other one is pointing at another one. Please don't become a victim. So this is where we have to go as a government. We must take both the girl child and the boy child together and see how we work them together and ensure they coexist together. I thank you for the good work you are doing at the National Council for the Youth. And one time I was the publicity executive for the National Women. You know, I've been a teacher and everything up to today. I've been in Parliament, I'm coming with 30 years. And I changed the constituents from a district to direct. Now I'm beginning the first term. So I finished those ones as a district woman representative. I am beginning another term. So you shall walk the walk and reach where I have reached. As long as you are determined. Honorable Baguma told you, I'm the oldest from 1994. I am just a deputy Minister of State. Patience pays, and it pays because you have walked the talk and you have remained consistent. Loyalty works, but if you want to change the goalpost today, you are here, you are in red t-shirt, in yellow t-shirt, in what? My friend, that's not good. Focus where you want to be. And I can assure you, where you want to be, you shall reach there. There is no obstacle for you. And when you are focused that I want to be there, you will be there. You all look focused people, you have a purpose. But to get to this purpose and achieve your mission and objective, you must be focused. Try to look around the people you have around you. If they are not adding any value, please, that is called excess baggage. Say, I'm sorry, we'll meet, but as of now, I have a mission. I have a vision. 2/3 of you, in all of you here, in how many years, as long as you keep yourselves invest in health, make health generation, young generation, invest in your own health. Don't wait for the government. If they say, keep a distance, keep a distance. We are telling you, don't shake hands. Now you are not only shaking hands, you are embracing each other. What are you looking for? Can't you say hi? After all, you are now in the high era. Hi. But you want to go the other way where we went? Even me, my mother no longer says hi. No. Secure your own future. This is how far we have gone. Therefore, Government of Uganda and the Ministry of Health, and working through a multi-sector approach, is committed and has been investing in the protection of the young generation's rights to improve your health, including sexual and reproductive health, protect you from sexual, gender-based violence. That is our responsibility. And support you to enroll and complete school as you can get the required skills and knowledge to build your capabilities and agency. We have to supplement, but the first responsibility lies with you. This pandemic has really exposed the weaknesses in two different generations. Parenthood during this time has been proved that the parents completely forgot about their responsibilities. That is why you see all these pregnancies. The pregnancies during the lockdown have accelerated more times than before, meaning that these kids are kept in school for the school people management to take care of them, and the mothers, when they said go back to your mothers, they could not handle. So that's why we will I'll come to that the first. They locked our children from school. The pandemic locked all the kids from school. But when they went home, then those bad people, the boy child, a father, an uncle, a houseboy, a brother, they are the ones who committed all these crimes to our young daughters, to our baby girl. Please, this is your baby sister. You are stuck with her. Then when you say, my sister, what happened? Either you are the victim, your own father. It creates that trauma. When you know that your own baby sister was impregnated by your father, your uncle, your other brother, feel hatred. You have no way how to address even that baby to come. Others try to commit abortions, which is illegal and dangerous. Please, now that you are here, and at least you know and you have gone through the dangers, be our ambassadors out there. As a government and the sector, we are also very concerned, as I've said, about the rising rates of teenager pregnancies, which is a public health. Current teenager pregnancies given out by 2016 was at 25%, meaning that 1 in the 4 adolescents aged 15 to 19 years is either pregnant or a baby mother. Imagine calling you a baby mother. By the time they reach my age, I don't know what they will be called. Baby grandmothers. It's very, very disheartening. Teenagers getting pregnant is unacceptable, and it's our responsibility, all of us, to ensure that we put our hands together and protect the girl child. Of course, it has been said here the more baby girls we have, the more baby fathers we have. In the long term, it all leads to low productivity, which in the long term has negative implications on socio-economic development. The UNFPA representative has labored on that. Mine is to emphasize the repercussions that are associated with that. The ICPD25 therefore provides us an opportunity to reintegrate our energies and recommit to delivering quality health, dignity, rights, and agency for the young generation. The government of Uganda, among others, is committed to continue promoting universal access to all methods of family planning and to reduce the unmet need for family planning from 28% to 10% by end of 2022. The government of Uganda is to ensure support towards reproductive health and family planning supply and commodities to the last mile with our development partners' support. To ensure support towards maternal and child health, resource to adolescent-friendly productive health services, and of course, to ensure meeting the 10% budgetary commitment. You know, our budget now is a bit low because of the pandemic, but still we do pledge our commitment as a government to the 10% as we work together with our development partners to embark on educational reforms aimed at ensuring that girls enroll and stay in school, as well as scale up investments in the technical and vocational education to create employable skills and competencies relevant to the labor market. You must now focus to do skills that are very compatible and relevant in the labor market. I don't want to discourage you, but I know during my time, now I don't know. We most used to go for those subjects that were very easy. Drawing. Now, if you go to become an artist, I don't know how they call that discipline now, to look at my face and you get your paper, draw me. So are you going to go back after graduating to start drawing the face of your mother and your father? Think about it. You can do it so that you are doing it for a business, to have all these pictures you are seeing here, all these ones you are seeing there. So focus on whatever you want to do so that it gives you a living. Ensure that different dimensions of our demographic dynamics and diversity are integrated in planning and budgeting frameworks at all levels across the country. It has been said, and that is our obligation as government. Some progress has so far been made, as I've said. Ministry of Education is rolling out the sexuality education framework in different phases, as has been said, and I had Patrick elaborating on it and working closely with the Ministry of Health through districts has made family planning services universally available and accessible to all people at our health centers. More creation is needed, more awareness is needed. Ministry of Health is also in the process of analyzing the approval of the revised adolescent health policy, and it's an ongoing. The Committee on Health has already affirmed to that. Ministry of Education, Ministry of Health, and Ministry of Gender have jointly worked at school opening strategy. The Assistant Commissioner, and our development partners, and as I speak now, I think there is a meeting going on with the Minister of Education, and we are looking seriously to have the schools reopened in January. But this depends, again, for safety of yourself, your neighbor, your mother, your parent, our kids. It's very unfortunate that now we have taken a long time off the second wave, because every person, every Ugandan, the population had been very vigilant in observing and aware of the dangers of the second wave. a third wave called Omicron has come in. That's why I'm saying secure your life has come in. We started with 7. As of today, we are above 70 cases. We have not yet even managed it as of now. In the morning, we had a strategic meeting. I'm going to Karanga and come back. We have on Monday to have a cabinet decision. What do we do? We are still waiting for the World Health Organization to scientifically tell us what do we do after the first jab, second jab. Now, if the first jab and second jab, these other people cases are affected, how about you who is not yet vaccinated with the first jab? Let's save our lives. And let's save our neighbors and our people. You are safe when your neighbor is safe. If you are seated next to her, I'm not saying yes, and she has, she's a case, you are all cases. And you know how many are all cases outside there? So why don't we save? It is a preventive measure. So as our young people, please, I want to ask you that we join the fight together. In the just concluded month of this month, the Minister of Education, the Office of the First Lady and the Office of the Vice President, the Office of the Prime Minister, Minister of Gender, Minister of Health, UNICEF, and our friend, partners, UNFPA, they have launched a national campaign to address defilement, which is now outside there as a public outcry, child marriage, baby mothers, teenager pregnancies, and we need to promote positive parenting. Because we can't leave these girls, my daughter met in Kamuli. It's going to be a problem. It's going to be a generation that is unproductive, with unproductive babies. Society that is unproductive. The moment the society is unproductive, there is poverty, there is stagnation, and everything is just at a standstill. So I'm very happy that today we have gone through all of this. The Minister of Health is committed to ICPD agendas, I have said, and FP 2030 commitments. We may be slow in implementation and commitment, but at least we are focused and we are sure indeed that we shall ensure and realize the commitments that we made, because these were not as a country, but these were global commitments. I have said much, I may have said nothing, but if you decide to take nothing, because I've been speaking, if I've been talking, there must be that there's something I've said. But if you decide not to hear what I have said, then you have to find out from your neighbor that was she speaking or she was murmuring. But you know why we have the ears? That the ears normally have to hear what people say, but if they decide that the other one. But for me, I'm happy that the young generations that is here, you have spoken. And as a ministry, we have heard. And thank you so much. Don't get tired of speaking. Continue. The more voices that come out, that's why I say, we have to hear them. I have heard. On behalf of the government and on behalf of the ministry, I've heard all of this. I've seen the presenters, what they presented here. Therefore, the government of Uganda is committed with securing your future. Committed. Because if it is not committed in these all years, and you think somebody coming yesterday will be committed, these are governments. These are not individuals' plans and policies. If there is no resource bag there, even if you made me the president of this country, I will not get money out of my bag. And even if there are no good policies, That is why I'm happy you are coming to be part and parcel of the policies. Policies coming from you. The priority area working from bottom to top. So meaning that many things will change. So as a government, we are committed for securing the young generation's future and of course to the fulfillment of our commitment and obligations. COVID is here and we don't know when it is going. Few days to Christmas. Christmas is a 1 year activity. 1 year. I have said it, I've seen one of my sons is doing like this, warming up. That is good. But don't go to warm up and the excitement of Christmas takes you along with it. You are going to the village, you are going to mix up with many people, you are going to enjoy, you are going to forget about the mask, you are going to hug yourselves, you don't know the person you are hugging, where she has been and where she has come from. I have talked to you as a mother. Please. And even you, don't take your COVID away. Because those people are saying, don't come. Kampala people, you have your COVID. Now you see the stigma. So what I'm calling upon you is please, I wish you enjoyable Christmas season holidays, but please do observe the SOPs and other. The bars have been opened, I think. The dancing halls, they are going to open. Now the kids want to go to school, you want to go and impregnate them. Oh, really, you hear from me, my daughters. We are saying open. Now some of you are anxiously waiting to become the what? The culprits. I have talked, you have heard. My daughters, don't allow your brothers to go and mess up. They are messing up with their own sisters and our own people. Therefore, as a youth generation, the government and the Ministry of Health looks forward to working with you closely as we have been doing. We shall double, we shall make a lot of engagements with you. I am happy that now I'm the Minister of State in charge of general duties, but all these activities are under my docket. And as I've said, I enjoy dealing with my young generation, my daughters and brothers, and to ensure that we have a bright future, a promising generation, our future leaders who will take from us. And then I will say, why I am happy. So and so the chairman from the Youth Council, Patrick, or I have seen this committee they have introduced, and the paper you have presented here is very reassuring. I commit that my office and the door is open. We shall always share out together and work to the success of our mission as UYAHF together with our development partners. I say all this for God and my country. I wish you the best, wish you good life, I wish you good health. I want to ensure that we meet next when all of us are saying, wow, all of us are happy. Thank you so much, and God bless you. Thank you. I'm still here. Now it is a launch. Now, are you a youth? This one is like my assistant commissioner now. I am telling you. Now, my other second is to ensure that we have been sitting as we stand up, so that I take this opportunity to launch the ICPD25 useful position paper Uganda. I would be happy if all of us we had our copies, because the launch was supposed to say we write somewhere. The steering committee can come in, and all my other partners, the vice, my MP, chair, my representative, and the Chair National Youth Council, you can imagine, and the honorary mother baby girl, you can see, Commissioner, come, this is for you. We don't want to miss you out. Where is my team? We have to do it into this way. Now, your mask, if you have no mask, then there is a problem. Then there is yes, no mask, no launching you. No. For you now, you have to do it the other way. Kachumbali. You see, that is the healthy mind. We are going to say 1, 2, 3, 4, or we start from 4 to 1, then it is launched. So somebody start with us. 4, 3, launched. Then Obugaro, launched. Thank you so much. Thank you so much. Thank you. You know, in Parliament, they call me Senga. Those in Uganda, I know what that means. Now I understand there's another where that those ones who have been extremely doing their best, and we encouraging them. Today this paper is coming empty-handed. Next time we shall see how it comes heavy. So, yes, I'll be handing over one, and all of you come here. How many are there? There are 5. Okay. Now, the first one is called Fredina Tinomujuni. That is a refugee, and he's here. I can tell you that he's really coming from far, and I want to congratulate you, but you will not touch me. We shall always say, we shake our hands like this. Thank you so much. And I hand you over to this as a certificate of excellence. Thank you. You can shake them like this and wish you the best. Thank you so much. Thank you. Oh, my MP should also come in. And they oh, those is that. When you get it, you can have. No, they have to remain so that they do like this. Now, the next one is Charles Owekimeno. Charles Owekimeno. Charles, I understand you are not around. Now, there is who is coming in. So now that you can do this one, they want a picture. And we do like that. And this one should congratulate you. Next time they will give you an envelope. Now, our third excellent performer, and we wish to encourage you to continue. Next time we shall come with our gold medals here. Hirare Niwamanya. Hirare. Wow, he's the one who made those commitments of the priorities and what? He wouldn't walk out empty-handed. Wow, congratulations so much for being active and that. This one. Yes, they are young people. They are the girl child. This girl child is called Annie Aran Sinzom. I think I had her some things here. Aran Sinzom. Wow. This one should dance Katumbari. You see, that is our own young daughter. Thank you and congratulations. Thank you for that. Yes, and especially the hair says it all. Thank you and congratulations. Thank you so much. The other one is the girl child by the name of Dr. Olive Sentumbwe Mugisa. Wow. Now this is another young girl. Congratulations, and we encourage you. Thank you so much. Thank you. You can go through so that you get an envelope next day. Thank you. Another one is Dina Nachiganda Busiku. Wow. Now another girl, baby girl. Now baby boys, next time, I'll have more of you. Thank you so much. When we give these ones, they are receiving on your behalf. So because this is your achievement as a forum. Thank you so much. Congratulations. Thank you. Thank you. Pass through so that you get another empty envelope. Tomorrow, it will be an envelope. And the last one is for myself to say, thank you, Anifa, for handing over these certificates. Thank you. Thank you so much. God bless you.
Thank you so much, Honorable Minister. Thank you so much. Another big round of applause to everyone who has been thank you so much. Thank you so much, our guests, the guest of honor, the UNFPA country rep, our board chair. Thank you so much to the women. Kindly take your seats, and we want to end briefly. I want to invite, without any further ado, the chairperson, National Youth Council, to make his remarks, and he will also invite the senior adolescent in the room to also make his closing remarks, and we'll have this come to the end. Thank you so much.
Honorable Minister, you'll forgive us for the protocol. It is because there's going to be another panel for which we would have sat. And so that is why I can accept to speak now. Yes, I think let's allow the Honorable Minister exit because she's pressed for time. Thank you, Honorable Minister. Thank you. So I am not going to make a speech here because I know we're all tired. I am just going to say the National Youth Council is glad to have come here and witnessed this. We'll follow up with the organizers on the commitments, and wherever Patrick and the team is, please do as much as, I know I'm asking for too much, but do as much as helping us see what we can do to help these commitments get achieved or get pushed forward, and then leave the rest to us. That said, I'll end with my name. For those of you that don't know me, my name is Jacob Eyeru. I'm the chairperson of the National Youth Council, and I'll now invite the Assistant Commissioner, Youth and Children Affairs, to use as short a time as I have so that these young people can get home before curfew. I thank you so much and welcome the Assistant Commissioner.
Thank you very much, my brother Jacobo Eru. The leadership that put this together for us today. The young people, ladies and gentlemen, I bring you very warm greetings from the Ministry of Gender, Labor, and Social Development. And I thank you for having come together under this summit to dialogue about issues that are so important to all of us. The health of the young people. 25 years after the International Conference on Population and Development, what are the missing gaps? What have we been able to do? What have we not been able to do? And this brings to me a lot of happiness, because when you see young people sitting together and discussing structures through which you can air the things that concern you. And I'm happy that I'm speaking after the chairman of one of those most powerful structures, the National Youth Council. For us, we believe that when young people are led very well by their fellow young people, they will come up with solutions to solve their problems. I want to urge you that during this digital migration, utilize the versatility that you have in ICT to find innovative ways of solving the various problems. Young people accessing the various commodities that they need for family planning, because family planning is one of those things that I think is important for us, that we need not produce more than we can look after. Let's produce a few people. When you reach the age of producing, produce 2 or 3. That's enough for you. Many of you say that the Bible says that go out there, multiply, and fill the world. When the Bible says so, it said go out there. Who? All of us. So why do you think it's your responsibility alone to produce 20, 30 children? If God, the Creator himself, produced 1 child, who are you to produce 20? Tell me. For me, the Bible I read says, and his only begotten child, Jesus Christ. If you also think you are son of God, go and read the Bible again. We need together to fight poverty, to downgrade the profile of poverty from 21.4% to below 10. And if we continue that way, again, it's Mahatma Gandhi who said that poverty is the worst form of violence. And the duty of fighting poverty lies on all of us' shoulders. One professor said that, in Africa, the poor people don't sleep because they are hungry. And the rich people don't sleep because the poor are awake. Therefore, it becomes incumbent upon all of us, especially the young people, to ensure that we fight poverty, because poverty comes along with other vices. Finally, as government, we shall continue to do our job of policy and legislation to ensure that we set a framework within which we can operate. I want to thank you once again, and I promise you our total commitment in whatever you want to do as youth organizations. Our total commitment. The chairperson warned me not to speak more than what he said. And with those few words, I declare this one-day summit officially closed for God and my country.
All right. Thank you so much, our great speakers. It has been a very wonderful day. It has been a very packed day. A cocktail of events has happened since morning, and we have had a lot of wonderful deliberations since morning, and a lot of commitments. A lot of good things have been, achieved since morning. I would like you to clap for yourselves with a very loud of applause. Thank you so much. Thank you so much. Karibu sana. Thank you so much. To our dear facilitators, speakers, panelists, and all that, thank you so much for being there. I would like also to say thank you to all our partners, all our people who have been here, those who have joined us, National Youth Council, New Life Adolescent and Youth Organization Uganda, Wakiso District, HEPS, JSI, Heroes for GTA, Reach a Hand Uganda, Juma's Foundation, SRHR Alliance, Ministry of Health, GISI Initiative, T-Touch Rights, Nile Girls Forum, Marriage Stops Uganda, UWFPA, NPC, NEO, MOE, Alive Medical Service, Ministry of Gender, Plan International, Naguru Youth Health Network, UAF, Miss Uganda Foundation, and Foundation for Male Engagement. Thank you so much. It's been a pleasure to have you all today, and I've been your wonderful host, Dr. Ben Chividige, and thank you so much for allowing the day go on smoothly, and I can affirm to you that we've reached the 7th and the 11th hour of this day. Thank you so much, and the conference or the summit is already declared closed, and I want to say thank you so much. Safe journey back home, and we are going to end with a group photo as directed by Mosh. Thank you so much. May God guide you as you're going back home. Oh my God, sorry. They have told me that we do have tea. Do not leave us without taking tea. I know the young people like that so much. I'm sorry for annoying you at the end. Please, your tea is there. Go and have the refreshment. You can pack everything. Please, it is paid for you. Go and enjoy that fellowship. Thank you so much. I can now see the happiness of young people when I talk about tea.